Hello, everyone. This is Geronimo from Jolt to Grow, and I'm here with Coach AJ,
Hey,
our
how's it going?
resident coach at Jolt to Grow, the man that helps so much guys improving their intimate health. How are you doing, Al?
I'm doing okay. How are you?
Everything's going well.
Nice. It's good to hear
And
from you again.
Yeah, definitely. Good to see you too. And today with Al, we will be talking and delving into a topic that's often not it's not discussed as it should, and I'm referring to um, penile rehabilitation after prostate surgery. So maybe we could start with a couple of questions. I'll start asking Al because he's the expert um, to tell us a little bit about what happens when a man gets this sort of intervention on his penis. I'm sure there are some big consequences. So, Al, what happens after
Yeah.
penile rehabilitation?
Okay. Well, what needs to be understood about this surgery, and I know that medical techniques are changing all the time. And to my understanding, some of the newer procedures are not quite as bad. I think that there's been a very big shift towards trying to uh, spare the bundles of nerves
Mm,
that are around the penis, because when they go in to remove the prostate, there's bundles of nerves on either side that obviously, if they're uh, tampered with during the surgical process, there's going to be damage. So what often happens is that it says in 85% of cases, from some of the information that I've read, that some men will experience partial or total erectile dysfunction.
wow.
The recommendation is to attempt to induce erections, especially and the signs that are good are if you're getting spontaneous erections, especially erections at night.
Mm,
That's a sign that there's still something going on, and you build from that. A
mm,
lot of the problems that happen with men who have the surgery, though, is that they don't address the issue in a timely manner. The longer the more time that passes from the surgery and you're not having erectile activity, the more the deterioration happens. And I think the medical literature talks about how if the issues last for like 2 years or more,
Oh, yeah,
that
I've
the
read
issue,
that too.
yeah.
Like, penile rehabilitation is often more effective when you started doing it like right away after the intervention, right?
Yes, and also if you're younger, that helps because if you're over 50, if you're 50 or older, according to literature, you're going to have a bit of a harder time.
Yeah, that makes sense.
So, but
So,
yeah, and I think part of it's a lot of it is like sometimes they have to get in there to see what's going on. So making a prognosis before the procedure can be hard, but a good doctor will attempt to spare those nerves. But there's
mm,
only so much that they can do. So it's even with a nerve sparing surgery, you still may experience some ED. But if you could recover that erectile function and keep working towards that, uh, that can be helpful.
sounds like a very invasive method, but certainly, I guess in most cases, the only remaining option, because if our audience, if the people that are watching now don't know this, we're talking in the context of prostate cancer, right, Al?
Yes.
And the possibility of having your prostate removed. So I've read that apart from ED, this surgical technique has some other type of consequences, and this is often one of the channels, if I'm right, if you will, one of the reasons that makes the medical community closer to the world of male enhancement. since plenty of the let's say devices or machines that are out there available are usually prescribed to patients that have these sort of treatments, these sort of interventions to prevent one of the, well, main consequences apart from erectile dysfunction. And I wanted to know, Al, if you could tell us a little bit about that. And I'm talking
Sure.
about penile shrinkage.
Yeah, because that's, the penis is like any kind of organ. If you don't use it the way you're supposed to, it's going to atrophy. I think the most common recommended procedure after this surgery is, and a lot of it's going to depend on the patient and how responsive they are and how responsive their penises are, is the vacuum erection device, otherwise known as a pump. Normally, what's recommended is that you use this almost every day. Certainly, if you're still sexually active, you get to a proper degree of erection, and then you use a ring to maintain that erection. So, I mean, you could use it for sexual contact. You could also use it to train, to make sure that you still have blood going in, that you're still, by forcing blood in there, you're still working the vessels, you're still expanding the tissue. So, it's almost like a coma patient. A coma patient can't move, but they still do, they still move their muscles and massage and whatnot. There's still
right.
some activity there.
That's right. Makes sense.
Yeah. And another alternative that's quite effective is you inject a substance called trimix, or I think the more recent quad mix. Yeah, and you inject, I think it's 2 small injections into the corpora, into each corpora, and you wait several minutes, and you get a full erection lasting
Wow.
for like quite about an hour or something.
What's the name again?
Trimix or quad mix.
Quad mix.
And they inject these very thin, a very small, thin needle that they use to. You're supposed to do it yourself.
So this is for preventing penile shrinkage,
Well,
or
it's
something for before getting intimate, let's say.
I mean, it serves a dual function, because I mean, you have to. I mean, if you're still using it, you're going to prevent loss to some degree. So, I mean, I believe that the Trimex is not to be used. I mean, you're injecting your penis, so that's not something you're going to be using frivolously. And even for training, you probably, if you can avoid doing that, that'd be good, because, I mean, there's going to be side effects of using needles. It's been reported that people that have to do that, they have to shift the position of where they inject, because if not, you get a risk of scar tissue. So, and obviously, if you can induce an erection via other means, that might be helpful. There's another method that's not as well known. It's called a urethral pellet. And it's like where you place a little pellet into the opening, into the meatus or the hole of the penis, and it melts and it leads to an erection. It's not as reliable as an injection, but if someone is averse to getting injections in their penis, that might be another route that they can take.
Wow, I never heard of those last 2 methods. Certainly lots to cover when it comes to getting these procedures done, and I guess a big portion of this rehabilitation, it's not just about improving the erectile quality or the erectile health, but also recovering or restoring the past size. Let's say past size.
Yes.
I mean, before the surgery, because if I understand well, correct me if I'm wrong, that after this procedure, it's normal to expect a 2 centimeter shrinkage after the procedure, right?
That sounds about right. And I think that does correspond with the literature. It's simply because there's less activity. And then
And I
there
guess
may be some.
also, I guess also there's yeah, the activity, the loss of activity, but I'm guessing nerve damage in even the surgical approach may affect the integrity, right, of the penile structures.
It could. I mean, there's all sorts of things that can happen with that, and I mean, a good doctor will do their best to try to keep everything working. But it really depends on how extensive the cancer is. I mean, sometimes they have to take tissue out. So I mean, it's a
Mm,
question of
wow.
uh, your life, especially if cancer's spreading in your body.
That really
If they
put
find that
things
they got
in
to take it
perspective,
out,
right?
even if it means affecting that nerve bundle.
Wow.
You know,
Yeah, that really put things in
yeah.
perspective. Yeah.
And I mean, those solutions I think are they give hope because I mean, you're still using your penis, and if there's some viability, I mean, there are some men who report recovery.
Hmm.
That they're able to restore function, and I think a lot of it has to do with what you're doing outside of immediately addressing your penis as well. If you're keeping in good shape, your heart is healthy. That's important because you have that blood flowing. I think you're gonna have a much easier time restoring than if someone who say is drastically overweight or has
Hmm.
heart issues or is just not in good cardiovascular condition. I mean, because there are other alternatives. There are alternatives for men have who either don't want to use the injections or the damage is really substantial. They have implants. They have the inflatable tubes. Some use two, and some use three. There's a
Wow.
2-piece implant. There's a 3-piece implant, and there's also a semi-rigid one where it's like you can fold it. It's like your penis stays semi-erect forever in a sense,
Wow.
and you fold it when you fold it down or to the side when you're not using it. So those are the options available to someone who doesn't want to or can't, for whatever reason, use a pump or the injections. The injections are not to their liking.
Traction therapy also plays a part, I guess, here, right? Especially in restoring penile size, right? I mean, I've heard, um, for example, well, it's interesting, I think, because there are a couple of devices out there. I mean, penile weights, penile, yeah, hanging systems. But I've seen that the urological community has developed their own versions of these products we tend to see more and more in the male enhancement market. And I've stumbled upon some of these devices, and there are some interesting versions of penile weights that have this sort of silicone suction cups that just you place the weights just next to the glands, but
Mm-hmm.
in a very lighter version. I mean, not what we're used to see in standard hanging methods for enlargement,
Yeah.
but there's definitely some level of mild stimulation there, I guess, to restore the size, right?
Yeah. It's like an all-day stretcher. It's just kind of,
Mm.
and the goal isn't necessarily enlargement. It's just to keep the tissues elongated.
Mm.
So that's that is helpful when the alternative is contraction, which
That
often
definitely
happens. I mean,
makes
you can
sense.
imagine that if your penis doesn't get erect and it doesn't get erect for a long time, those tissues just they stay set.
Yeah.
And you can imagine the months pass or whatnot. I mean, just trying to restore to a previous size would obviously take a lot more work. So if you're doing things as soon as possible after the surgery, that's definitely going to be in your best interest. But that's a lot of that's going to depend
On the pain,
the
right?
scope of the damage done. Of course, speaking with your doctor and trying to get a realistic assessment of what you're going to be capable of after the surgery is always going to be a good idea. Because at the very least, that way you can make plans.
Mm,
If you're in a scenario where you can recover, even if it's going to take some work, then when you start setting up your plans to do that, start getting your mindset for that. Whereas if you're in a scenario where there's no obvious hope, then you try to arrange otherwise. Uh, but the thing is that medical technology is changing
mm,
and always advancing. So what may not be available now,
mm,
a few months from now, there might be something that comes around and
mm,
makes a difference.
definitely.
Yeah,
I
and
also
there's some new things on the market that we can talk about in the future there, but there's definitely a lot of interest and a lot of crossover with this type of issue and even male enhancement.
Yeah, definitely. In that sense, with all the available options out there, I'm guessing a good question would be, as a coach, what would you suggest, for example, as a plan of action, or maybe in the form of a routine, maybe for someone that it's reducing himself, he's introducing himself into these sort of techniques, or maybe combining some of these methods. What would be the actual most effective way of navigating into a solution?
Okay, that's a great question, and I think for this type of issue, a pump would probably be optimal. Because you're going to get that elongation, but you're also going to get that forced blood flow,
Mm,
and
that's-
you really need that. You really need that to make it work. So I would recommend a regimen that revolves around using the pump,
mm,
rings to retain the blood afterwards,
mm,
kegels if possible. If you can do that while you're erect, especially while when you have that ring. Extender work, light extender work, or light all day stretching
mm,
would be a good idea as well. Keep those tissues elongated. But like anything else, it should be something that you work into.
mm,
And I can understand the, uh, I could try to understand the desperation that someone would feel after going through something like this to try to make sure that, their potency doesn't uh, dissipate too much. But you have to be careful not to hurt yourself too. So always train in conjunction with your doctor's instructions, because there might, if you're just coming off a surgery, you may not be able to do anything for a while.
yeah.
But definitely talk with your doctor about it. Some men who still have some erectile function very often, I've spoken with these guys, and they'll say that they get a course of Cialis or Viagra or something to, especially before you go to bed, because you have that
Oh,
nocturnal
really?
penile activity.
Oh, that's
Uh,
interesting.
yeah, that could be helpful. And some doctors even recommend that to men who just have, some form of mild to moderate erectile dysfunction. You take a low dose of Cialis or
Daily,
Viagra,
like daily,
and
right?
that what now?
Daily, you take that daily?
Yeah, like before you go to sleep. Like
Mm,
before you go to sleep, and of course before or anticipated sexual contact. But yeah, that would be something in addition to what you're doing
mm,
with your training to help out. But like anything else, you always ease into it. With pumping, start very light. 5 minutes. At 3 to 5 inches of mercury. It's very light, and slowly work up from there. When you can induce that erection, use the ring for a few minutes, and then again slowly grow that into a more viable routine. So when you're doing something where maybe you're pumping for 10 minutes, and then you're
mm,
wearing the ring for another 10 minutes. That's 20 minutes of blood flow, and that's excellent. I mean, that's definitely going to carry over into keeping those tissues expanded, and then of course maybe following that up with some light stretching all day. I think an all day stretch would be perfect for that, because you just set the weight and let it do its thing. but very light extender tension would also work well.
Sounds like a very holistic approach. And for you guys to know, the routine I'll just mention can be found on the description of this video, of this episode. Certainly, this is a very touchy subject. I mean, when it comes to the penis, it's generally a touchy subject by itself, but I mean, this is something that it's not so discussed between men, and it should be, because it really causes lots of distress. And I mean, it really put things in perspective, that it's great to know, I think, that there are possible solutions when it comes to be able to enjoy sexual pleasure and love again, in a sense.
I agree, and that's, I think, I know the internet gets a bad rap for a lot of things, but the internet is also responsible for creating communities, and there is a male enhancement community. There's been one for a long time, and even in places like Jolt to Grow, where you have guys who can get together and talk about these subjects, whether anonymous or not, having someone to talk to is just so helpful.
Mm.
Having someone who shows some caring about it. But it does require a bit of courage. I mean, consider that, how many men like to talk about their private lives like this, especially when it comes to something like, it's not even so much the ego. It's just, I think a lot of these guys, they feel shame, that something isn't working, especially as something as fundamental as your penis.
Definitely. I mean, the sole idea of masculinity and the power that implies that this not allows room, let's say, to vulnerability, in a sense. We need to be, let's say, potent in resistant to all things, even when it comes to health. That's usually one of the reasons why we tend to avoid going to the doctor, because we feel like we're stronger than it, and we'll get past it.
It is, but it's interesting because that's a surface level way of looking at it. Because the reason why you're not going to the doctor too is not, people say that, but you're not going to the doctor because you're afraid you're going to hear something bad. Because if you weren't afraid, then there wouldn't be a problem, But you're definitely right about that, and having a place where you can talk about this is definitely a good thing. There's a lot of great resources on the internet, include our Jump to Grow site, where you can meet like-minded people to talk with about these subjects. But there's definitely help. There's definitely help. These guys are not alone. All of us get older. If you live long enough, you're gonna, you're eventually gonna run into some things. Even if you're healthy, it's just,
it's a part of life.
It's a race against the clock, and all of us lose in the end, in a sense. But we could do our best to try to maintain good health for as long as we can, and to continue leading full and happy lives.
Definitely.
There's a lot that you can do. I mean, it's easy to say that, you get older and whatnot, but, if you really conscious about your health, if you, you see something happening and you can, you can train to help to prevent it and to even reverse some of these issues, then by all means do it. If it's within your capabilities, then do it. I mean, there's something that, that maybe wasn't around, a generation ago, is that there's a lot of options. This is, the issue of erectile dysfunction is an ancient one. There's been, and I know that, so many cultures out there, they have their own remedies for that kind of thing, whether it be herbs or potions or whatever. So this is, it's an almost ubiquitous kind of thing that afflicts men as they get older or they get sick or whatnot. So, doing what we can to help stave that off is always in our best interest.
Indeed. Yeah, this is one of the of our main missions, to provide solutions and also a safe space for all of us to feel free and comfortable discussing these topics in our health in and feel supported at the same time. So thanks all for explaining in so much detail when it comes to possible solutions to addressing this situation.
Well, thank you for having me.
No, it's a pleasure, and I think this topic should be more discussed. And guys, for you to know, again, you can find some of the articles we've reading about this topic in the description of this episode. And thanks everyone to watch us today, and stay tuned to our following episodes. And we'll have lots of interesting topics in the near future. And remember, the routine I'll shared some moments ago will also be in the description. And if you have any questions, any topic you would like Coach AJ to explain and delve into, please do so. So Al, thanks again
Thank you.
for being here, and see you the next time.
See you. Thanks.